Hello and welcome. I'm Dana Kabunda, and joining me today for a very special interview is Dr. Karyne Wilner. She is a clinical psychologist and body therapist who reveals how anger, whether it's expressed, repressed, or misdirected in harmful ways, creates stress in the body that can lead to physical and emotional health problems. She offers body-based practices and CBT techniques to transform anger in ways that lead to greater health, vitality, and purpose. She's the author of Releasing Toxic Anger for Women, body-based practices to let go of negative thoughts, soothe stress, and stay true to yourself. Thank you so much for being with us, Dr. Karyne.
It's my pleasure. Thanks for having me.
So your book focuses on women and anger. Does anger affect men and women differently?
Yes, it does. First of all, in the culture, men's anger is much more acceptable. An angry guy can slam a door, scream at somebody, and they're not going to hate him or talk about him later. Where an angry woman gets called a bitch, she gets called worse things, she's told she's crazy, she doesn't know what she's talking about. Secondly, it affects our health differently. Men are more apt to have heart attacks and strokes if they're loud and angry and fierce and violent, where women, if we suppress our anger, are more likely to have cardiovascular problems. And that is a problem for everyone since heart disease is the #1 killer in the United States.
Well, what are some of the long-term effects then for anger on the body?
Well, it has a deteriorating effect. What happens is adrenaline and noradrenaline and cortisol, these are all stress hormones that are triggered by anger, and they go into the body. And if we don't release them from our body immediately, they start to poison us. So can you imagine if you're angry even several times a week and you have all those nasty chemicals floating around in your body? They affect your organs, they affect your muscles, and they are a part of disease, and research has evidence toward that.
Is it possible to reverse the effects of anger if we don't find a way to control it?
Yes, I think it is. First of all, you need to manage your anger, and that means you need to accept that you are angry. We all have that. And for women who tend to suppress it, they need to find a way to be assertive and to say, "I'm angry, and I want this to be different. I want you to treat me differently." And even for men, rather than screaming and yelling, they need to be assertive and not cruel or nasty, because that hurts their cardiovascular picture. So yes.
And what tips do you have for women to release that anger?
Well, as I said, talk about it, but also be aware of your body. A lot of us aren't in touch with anger when we are angry. So body awareness, and you can do that through relaxation exercises or body scans, help you know when your muscles are tense and tight. And whenever that occurs, whenever you're stressed, you have anger, and you need to find some way of releasing it. Jumping jacks, running in place, it doesn't matter what, you have to do something.
Oh my goodness, such great advice. Thank you so much for joining us today. To learn more about Dr. Karyne, her book, and all her projects, please visit her website at drkarynewilner.com. Thank you so much.
Thank you.